We're going to turn back to our breaking news this hour on the fight against the coronavirus. The FDA has authorized the Pfizer vaccine for emergency use in kids ages 12 to 15, paving the way for millions more Americans to get vaccinated. Joining our conversation, Dr. Michael Anderson, a pediatric critical care physician and senior advisor at the Children's National Hospital in Washington, D.C. Since the beginning of the pandemic, you and I have been talking about kids and COVID, whether in the context of classrooms or whether they can get sick. This seems like a huge deal for the country's fight against COVID and for parents who have been terrified for the better part of 14 months.
Nicole, this is a historic moment. And you and I, as you said, have been talking about kids since the beginning of this. The thoughts that kids were immune, kids weren't infected, that's just false. We know that there's 300 families across this country that have lost children to this. We know that kids are carriers. We know, thank God, that kids seem to get less ill from this disease. But we are never going to get back to a state of normalcy. We're not going to ensure a bright future for kids until the vaccine can protect them as well. So the fact that we're now going down to age 12 with Pfizer through the EUA, this is literally a historic moment where families and pediatricians and child advocates are celebrating.
So tell me what people should know about the thoroughness of these trials. And I ask that as someone very aware that we live in a country with, unfortunately, some politically influenced belief systems around vaccine safety. Just give us the facts.
Yeah, we do know that, unfortunately, it has become politicized. And I can tell you that the FDA has put these vaccines through a very rigorous process. They have approved them under what's called an emergency use authorization, meaning that the evidence far shows benefits outweighing any minimal side effects or minimal downside to them. And the fact that, once again, we're able to get these vaccines into more kids brings us back to normalcy. We're going to have to do more research, because what about the 11-year-olds? What about the 10-year-olds? Once again, if we're going to be an immunized community, we've got to get more and more kids vaccinated. And I know the companies are looking at that. But the bottom line is that these are safe vaccines, Pfizer being the first one approved for kids as young as 12. And the second thing I would say, you and I have talked about vaccine hesitancy. I think it's really important, like pediatricians and family medicine docs and nurse practitioners do every day, that families rely on their medical home. Let's talk about this vaccine. Let's talk about if it's right for my kid. And I can tell you that pediatrician after pediatrician are just lining up to say, let's have this conversation, because this is a really important day.
I have to say, my pediatrician has not been wrong about anything all year. They do. They look at the family and they look at the child. I want to ask you about the actual vaccine. Is it a smaller dose, a lesser dose? Is it still 2 doses, or was the trial just to make sure it also worked in kids?
It's 2 doses like everyone else, or I'm sorry, like the adults over the age that have gotten Pfizer. So it is 2 doses. I think there's still an unknown out there whether you're an adult, and I've had 2 doses of the other one, the Moderna. What's this whole concept of a booster? Are we going to get to a once-a-year booster? But it is 2 vaccines. It is the same dose for kids 12 and up. But you raise a really good point. Now for the younger kids that are obviously smaller, have less body weight, we're going to have to figure out what the safe dose is for those kids. But it is 2 doses. And like I said, I think we've got an interesting question to ask us moving forward, not just for kids, but for adults and kids. What's this whole notion of a booster? How do we get back to some semblance where this feels like influenza, where, yep, now it's the fall and I get my flu vaccine? I think that'll be a time to celebrate, too.
So the Biden White House has just announced that this can happen immediately, that if there are doses, they can now be administered today. You can take your 12, 13, 14, or 15-year-old to get a vaccine. Is that something you recommend?
I do. Children's hospitals and pediatricians across this country have been revving up for this moment. So we have dose. I know here in the D.C., Maryland, Virginia area, there are several centers that are ready to vaccinate kids over 12. So I say get in line now, figure out with your pediatrician how to get this dose. This is going to get us back to a much more normal state. It's going to get us back to a fall that feels like a fall in school. And like I said, we still have work to do on the younger kids, but getting kids down to 12 vaccinated, this is just so historic.
And I think that what what I'm beginning to understand is that when you look at countries like Israel, where transmission has been extinguished, it is in getting your numbers up to that higher percentage. How instrumental is it to reaching our numbers to get kids as part of the vaccinated population?
It's so huge because, as I said, we've accumulated a lot of data since this came out, right? We know kids are transmitters. We know that within a household, a child, thank God, doesn't have typically the same severe symptoms as adults do, but we know that they're transmitters. So if we're going to get to this notion of herd immunity, kids are 22% of the population. They're probably the most important part of the family. So getting children to be a part of this immunization wave, if you will, it is so vital. It's also very important. You and I have talked a couple of times about the unfortunate rare thing called multisystem inflammatory syndrome in children. As much as we can do from preventing the spread, that's going to do two other things. It's going to decrease the ability of variants to emerge, and we've talked about variants over this time, and hopefully it's also going to decrease that rare but really heartbreak number of kids that get this multisystem inflammatory syndrome. So slowly but surely, the higher percentage of the population, we're going to get back to feeling normal.
I'm so glad you mentioned that almost 300 American families have lost their children to COVID. And I remember, I think I reached out to you with my terror reading about the inflammatory syndrome that affected kids. There were a lot in New York. I read it in my local paper and saw it on the local news. Can you talk, too, about the mental health toll that the pandemic has taken on kids? My son still learns remotely. This seems to end the debate about in-classroom learning. Everyone goes back to the classroom now.
It's so huge. I mean, we've known in the world of child advocacy that the demand for pediatric mental health care services far outpaces the supply. That was true going into the pandemic. And now the number of children that are suffering from anxiety, suffering from obsessive compulsive disorder, we've been telling them to mask, which is really appropriate, but now they're so scared of their surroundings. So the mental health toll is just astronomical with this. And I think it's terrific. We've got kids going back to school. I keep saying we have a generation at risk that are going back to school. So we as a whole of society, schools alone can't fix this. Children's hospitals and pediatricians can't fix it. But we have to realize the number of kids that are suffering from this pandemic is astronomical. I keep in touch with some of my residency colleagues on a group text message, and most of them are general pediatricians. They've informed me of the terrible cases of obsessive compulsive disorder and anxiety. So it's terrific the vaccine is here, but your point is so well taken. This entire generation of kids is at risk.
So we are covering the breaking news. The FDA has authorized for emergency use the Pfizer vaccine in kids ages 12 to 15. I have one more question for you, Dr. Anderson. What is going on right now in terms of vaccinating the youngers, maybe to get like kindergarten and up, between sort of 5 and 12 vaccinated? What's that process look like? What's the horizon?
It's a real coordinated effort between the pharmaceutical companies that want to study younger kids, actually potentially down to age 6 months. It's then a coordination with the FDA. How do we design these studies? What are the outcomes? How do we assure that there's safety? And then it's the children's hospitals and academic centers, and quite frankly, pediatricians' office. I know a lot of pediatricians that are anxious to help study what's the safe dose, how effective is it? And the really good questions you asked in the beginning. How many doses are we talking about? Because obviously younger kids have different physiology. We've learned a lot over the last decade. Pharmaceutical research in general to help support children's health has really come to a much better place. So there are already networks in place across this country to study down to, as I said, they're looking at potentially 6-month-olds. I come back to the flu analogy. We recommend flu vaccine down to age 6 months. So can we get a COVID vaccine that, of course, is safe, that is effective, that then allows us to say, yeah, kids 6 months and up, let's think about this like a yearly fall booster like we do for the flu.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.